ladies and gentlemen, and welcome to Story Makers. I am your host, Simran Patwa, and I'm thrilled to have you all join us here today. Ladies and gentlemen, today I am delighted to have Senior Consultant and HOD of Neurovascular IR Fortis Hospital, Mumbai, with us. Ladies and gentlemen, a renowned expert in the field of neurointervention to shed light on the critical issue of brain stroke in India. Ladies and gentlemen, India, being the most populous country in the world, is grappling with the strategic stroke burden, affecting almost 1.8 million people each year. This condition ranks among the leading causes of premature death and disability in the country. Unfortunately, stroke awareness remains alarmingly low, resulting in delayed or inadequate treatment. Ladies and gentlemen, join me and let us meet Dr. Rajeev Sivasankar. Hello, sir.
Hello.
How are you?
I'm good.
Okay, and thank you very much for saying yes and joining us here today.
My pleasure, and thank you for having me.
Thank you. So, please share me your journey till now.
All right. So, as a neurointerventionist, we all start off with our careers, getting our basic degrees in MBBS, followed by our masters.
Okay.
And it is a kind of triad of specialties who can later on culminate and become neurointerventionists. So you can have radiologists, you can have neurologists, you can have neurosurgeons. So all these three specialties can culminate and become neurointerventionists, which are basically endovascular neurosurgeons.
Okay.
Right?
Right.
So to put it very simply, it's like medical plumbers.
Okay.
Diseases of the blood vessels of the brain or the spinal cord are dealt with by specialists like self.
Okay, all right. My very first question to you would be, what is brain stroke? Because I think by now that we're discussing about brain stroke, many of them definitely wants to know what brain stroke is and how severe the disease is.
So, like you've very appropriately brought out in your intro, that brain stroke is a very serious condition which afflicts a large part of the population worldwide.
Oh.
It's a global epidemic almost, and that's a condition which is caused because there is an affection of the blood flow which reaches the brain. So think of the brain like a fruit at the end of a tree, right? Now the fruit needs nourishment.
Right.
Now what brings it the nourishment? It's blood.
Blood.
Right? Now if there is a disruption in the flow of blood to that fruit, it's going to affect its function.
Definitely.
So that could lead to either death or disability. Now, stroke is that condition which is disrupting the flow of blood.
Okay.
And that disruption could occur due to one of two ways. It could either be a bleed, which is called a hemorrhagic stroke, or it could be a block in the flow of blood, which is called an ischemic stroke.
Okay.
Right? So, of the large majority of strokes which affect us, a vast majority of them are ischemic in nature. That is, there is a block to the flow of blood which reaches the brain. So that, in short, is what a stroke is.
Stroke is, right. Definitely, if brain stroking occurs. So, I mean, what are the symptoms and how can one recognize, that, something like this is happening? So, could you please share symptoms of brain stroking?
Right. So, again, stroke awareness, to build this and to recognize this early, there is an acronym which has been coined to help us recognize that a person in the family or relatives or self has got a stroke. And that acronym is called FAST. So FAST stands for, F stands for face. So there will be a drooping of the face.
Okay.
A stands for weakness in the arms. So A is the arm. So there would be weakness of the arm or the leg or one half of the body. So that means there's a face which is getting deviated. There is an arm which is getting weak. The speech gets slurred, which is what the S stands for. And T to stress on the importance of time. Right? So what we want to say is that if a person in your circle, either yourself or your friends or relatives, you recognize them having some deformity in the face or a weakness, they're carrying the mobile and it just falls from their hand, or you feel like the slippers or the shoes are getting, just slipping off.
Right.
So those are subtle signs of weakness. Or it could be completely severe that a person gets suddenly paralyzed.
Correct.
Onto one half of the body. That is what a stroke is. And the T is the most crucial part, time. Right. So we should not underestimate this. Take the patient to a stroke ready center. The gharelu ilages of massaging and go to sleep and it's going to get okay are not going to work in this condition.
Not at all.
Take the patient to a hospital.
Okay. So there's nothing as such you call instant prevention or immediate prevention, something like that.
So the immediate first aid that we can offer, that's what you're asking, right? Yeah. So when a patient has a stroke, the first thing would be to ensure, now in very serious strokes, the patient could lose consciousness. If that happens, what would happen is that the patient's tongue could fall back and they could aspirate on their own saliva. So, or the patient could have a seizure too. If a patient has classically had a hemorrhagic stroke, he could present with seizures. So that's the time that we put them in a position in which basically the aim would be to prevent the tongue from falling back and the patient from choking on their own secretions. So you could put the patient in a position onto one side so that the tongue does not fall back. And the patient could breathe much more easily. And thereafter make arrangements for either an ambulance or your own friends or neighbors, something, getting a vehicle and shifting the person to the nearest hospital.
All right. Okay. So my next question to you would be that how can stroke be prevented?
Okay. Now that is a question which is very important.
Correct.
Because as the adage goes, prevention is better than cure, right?
Correct.
So the same factors which lead to so many of our medical conditions, like heart attacks, which are very well known, also cause a narrowing of the blood vessel of the brain. So what are these factors? Obesity, number 1. Number 2, diabetes. Number 3, hypertension. Number 4, smoking. So cessation of smoking, very, very preventable, very modifiable risk factor. Fifth thing could be genetics. Now, some people could be genetically conditioned or predisposed towards having strokes. So these are some of the risk factors. Now, they say that sitting is the new smoking, right? So it's important for people to be active. Right? And that goes a long way in preventing these conditions.
Sir, what are the treatment options for stroke?
Right. So now you could, let us assume you're talking only about ischemic stroke because that's the main killer these days.
Correct.
Of course, hemorrhagic stroke is important too, but we'll restrict this conversation to ischemic stroke, which is the block in the flow of blood, right? So when you have a small embolus, that is a small piece which has gone up to block that pipe which is supplying the brain. Now, if it's a very, very tiny piece, that piece which we medically term an embolus could either have come from the heart or come from a blood vessel which is in the path from the heart and supplying the brain. So anywhere in this entire tree, arterial tree, you could have the source of that little plaque or that little embolus which has flown up and caused the block. Now, if it's a very, very tiny block, then the patient can be given a drug, an intravenous drug, and that IV drug can help to lyse that embolus and to clear the block. That's number 1. The same drug can also be given for slightly larger emboli, but its efficacy goes down as the size of that clot or that embolus increases, which is why the mainstay in these patients would be a mechanical means of removing that clot. We could either put in a metal tube, which we call a stent, which has got a tail attached to it so that we can pull it out. So that device is called a stent retriever. Or you could put in a very navigable tube into that part which is blocked and suck out the clot, which is called aspiration, or you could use a combination of both.
All right.
So that's one way of doing it.
Okay. Sir, why there is so much of discussion about time when we talk about stroke?
Right. So there is a finite time
Right.
that our neurons can stay alive or viable
Okay.
with the lack of oxygenated blood,
Right.
which is why time becomes important, because if we deprive the neurons
Right.
of oxygenated blood for more than that finite time,
Right.
they will die. So if a person has had a completed stroke,
Okay.
you can say he has lost about 36 years of his life. Let's say he has survived the stroke, but there has been a loss of almost 36 years of his life. That's accelerated aging for you.
Oh my.
So every second that we salvage the brain and the neurons counts
Okay.
and leads to better outcomes, which is why the T, the FAST, that acronym, the T component of it is time, which is what we are stressing on, that bring the patient to a stroke-ready center at the earliest.
Right. Immediately.
Absolutely.
Or at your earliest.
At the earliest.
Correct,
At the
correct.
earliest.
Sir, what is comprehensive stroke center?
Okay. So a CSC, or a comprehensive stroke center, or an SRC, a stroke ready center, these are basically centers which have all the armamentarium which deal with stroke, which means right from your emergency room, your ER, which is well equipped to handle the patients who come in ab initio, to your imaging, which is high-end, which can immediately, in a matter of minutes, tell us whether the stroke is ischemic or hemorrhagic, and if it is ischemic, how bad is it,
Right.
what is the amount of brain which is salvageable and can be saved, and thereafter, how quickly can we either push in the clot-busting drug
Right.
or take the patient to a cath lab where we can pull out the clot. And thereafter, the story doesn't stop there. After pulling out the clot,
Okay.
there is an effect of that lack of blood,
Okay.
which means that the patient may remain paralyzed or without speech for some time,
Okay.
or may require ventilation, mechanical ventilation, be on a ventilator, after which the patient has to go to for stroke rehab. So you require a good stroke rehabilitation unit within the hospital so that the patient recovers their functions fast. So the whole aim of the game, if you can put it in one line,
Right.
is to get the patient to be functionally independent
Right.
after having the stroke.
So, Dr. Rajeev, could you please tell me that what is the major reason for stroking?
For strokes?
Yes.
So like we discussed, the preventable factors.
Correct.
The lifestyle diseases are one: diabetes, hypertension, smoking, sedentary lifestyle. Also, now there could be conditions like medicines. A person could be on medicines which cause the blood to clot, like oral contraceptive pills, etc. There could be underlying conditions which are genetic in nature, which cause the patients to have clots. There could be underlying heart conditions which can cause electrical rhythm abnormalities, which can form clots and then throw them up. So these conditions are the main causes of brain strokes.
All right. Thank you very much, Rajeev sir, for sharing your insights, your thoughts, and awareing all of us. Any last message you'd like to give to all our listeners and viewers? Anything you'd want to tell them?
Firstly, thank you for having me. I think this is a very important message that stroke kills. Stroke can be treated, however, and it's of utmost importance to be at the right place within the right time. So if you recognize that a patient is having a stroke, or even suspect a patient is having a stroke, please reach the nearest hospital as early as you can, and this will go a long way in saving a life and preventing morbidity. Thank you very much.
Thank you very much, sir. Thank you for
very much.
coming, and good wishes to you for your coming endeavors.
Thank you. Thank you so much.